Hello, my name is Daniel Stone, and I'm going to give a brief overview of acute migraines, some of the triggers that can cause migraines, some of the symptoms of migraines, both before, during, and after a migraine, and then some of the current treatments and the difficulty that comes with treating migraines that is cause for further research and the need for clinical trial study of migraines. Some of the difficulty that lies in studying migraines comes from the fact that the onset of a migraine is not fully understood, nor are all the causes of a migraine. And so some of the triggers that are reflected in the literature have to do with things like stress or sensory stimuli. There could be changes in a person's life, whether it's sleep patterns, hormone imbalance, activity or sleep levels, diet. Also, things in our the things that we eat, such as additives, or the things that we take in, such as medications, could cause the onset of a migraine. Even things such as weather changes, like a change in barometric pressure, has been shown to at least be part of the onset of migraines. The NIH data on the prevalence of migraines and severe headaches shows just the impact that migraines have on our society and how widespread it is, which is part of the motivating factor behind the research that's being done, the study that was done by Merck and others, these clinical trials, because there's such a large portion of our population that is affected. As you can see in this 8-year range, the average prevalence among women is 20% and about 9% in men, with a almost 15% overall corrected prevalence, which means about 1 out of every 7 Americans is affected annually. That's a lot, and migraine and headaches, they're the leading causes of outpatient and ED visits, and they're an important public health problem, particularly in the demographic of women during their reproductive years. So this is affecting a lot of people, and so we're going to see more research being done, and there needs to be more research done. Now, though it doesn't always work this way, migraines can occur in 4 stages, though not all stages occur for every person, and it doesn't always occur in each instance for one patient. But these are often things that you'll see with migraines. There's the stages of prodrome. It happens a day or two before. It could even just go into the hours before the onset of a migraine. And these signs are fairly subtle, but they can give a hint to the patient that a migraine is setting in. And this, includes, things like food cravings, increased thirst and urination, mood changes, stiffness in the neck, constipation, or other digestive issues. The next possible stage of migraine is aura, and aura are reversible symptoms of the nervous system. They're usually sensory oriented, sight, hearing. They can build up over several minutes, last for up to an hour, and they include things like seeing various shapes or bright spots, flashing lights, vision loss, the sensory sensation of pins and needles in the arms and legs, numbness in the face or one side of the body, hearing noises or music, difficulty speaking, uncontrollable jerking and shaking. And these symptoms are reversible. And again, usually, sensory oriented, but they can be experienced prior to the actual attack or the migraine itself. The migraine itself, the attack can last up to 3 days if left untreated. The symptoms and length of a migraine can vary, of course, from patient to patient, and different people experience different symptoms. And so it's beneficial to look at the inclusion criteria because some will only experience migraines rarely and others often. And so that was part of the inclusion criteria. Examples of that actual migraine attack include pain on one or both sides of the head. It's a pain that throbs or pulses, sensory sensitivity, particularly to light and sound, as well as, many people will experience nausea or vomiting. The last possible stage of a migraine is called post-drone, and following the attack of a migraine, patients might experience confusion, fatigue, a haziness in their thinking, feeling of being drained and spent. Sudden movements or sensory input can bring back the pain, though this is usually only momentary. Now here we have some of the current medications for relief. You can see for yourself they're diverse and include things like pain relievers, triptans, lasmiditan, abrogapant, opioid medications, anti-nausea drugs. And so, experiences will vary of these medications. And so people who experience migraines may have some level of success with some of the different current medications that are available. However, there are many dangers that come with these, particularly for migraine users, because the temptation is to overuse them. Overusing combination painkillers can actually trigger these medication-induced headaches. So, some of the medications there you can see are believed to start this cycle where those who are experiencing migraines will overuse painkillers. And the painkillers that at one point offered relief to the migraine start to cause headaches, which people then start to take more medications to stop those headaches. And so the thing that was helping them begins to hurt them, and the cycle continues. So of course, more research is needed, and the cause of migraines, as stated, is not fully understood. Treating migraines can be difficult, which leads us into the study that we're discussing. We'll now go over a brief overview of the MCP-Mod process. Some of this has been stated elsewhere in our presentations, and so some of it will provide a review, and then others will provide a little more detail than what has been given already. The main idea of the MCP-Mod approach is multiple comparisons and modeling, and it is a hybrid approach. As we'll see at the end, it's not unique in the sense that other hybrid approaches have been presented as well and represented in literature. But the idea is that several models can be suggested at the outset of a study. And this benefits statisticians and those running clinical trials, sponsors, because oftentimes it's difficult to predict the efficacy of a drug when the trial is being started, especially if there's not a lot of research been done on similar medications or treatments prior to the study, if it's new, and so forth. And so, the idea helps those in research as well as gives more flexibility. Now, the drug effectiveness is still based on these models, and a model is chosen that best represents and fits the data, best demonstrates what's being seen. And so, there's a lot of benefits to the process. The first step of the process is that, we check to see if the drug is effective by looking to see if the models explain the results better than the shape of a model of a drug that is ineffective. So you can see these models here and what they represent and what they tell us. This third figure is a no effect model. It's a pattern that describes a situation where the medication does not work, and all of the data is similar across the different doses, and there's not many differences to be seen. And then we have these other models, and what they represent are two different pictures of what the data looks like. In this first one, we see that there's a rapid increase in pain-free patients at the beginning, but there's not much benefit that will come after the dosage of 50 or so. And so we see, an increase here in the beginning, and then it flattens out. Whereas we see in this second model that, the increase is steady. We would still see more benefit in the 100 milligram dose than in the 50 and so forth. And it doesn't start to flatten out until much later. And so this step utilizes pairwise comparisons between the models and the no effect model. And we can conclude that this treatment is effective if one or more of the models describes results better than the no effect model. Step two, if one or more than one model describes the data well, then we go through a selection method. And this is familiar. We look for the model that is closest to the data points in terms of just the smallest average distance. And so you're looking for a model that fits the data. And just in terms of distance, if you're measuring this distance. And so now to protect from overfitting, which would be the temptation, of course, you see this third model here. It fits the model, the data perfectly, but it's overfit. It is unrealistic. This would not represent a normal dose response. And so to protect from that, the criterion penalize for the flexibility of the model. This MCP-Mod process can help with the difficulties communicated in early presentations. I don't want to repeat too much, but we're able to establish the efficacy of the drug as well as the minimal effective dose. And then we're also able to describe what percentage of cured patients we might expect at each possible dose. And so we get the best of both worlds.
And finally, we have an FDA review of an application that was submitted, and this application was a request for qualification of MCP-Mod as an efficient statistical methodology for model-based design and analysis of phase 2 dose-finding studies under model uncertainty. This application was later approved, and the data that follows is taken directly from that application. Janssen Pharmaceuticals and Novartis Pharmaceuticals submitted this request for qualification. The motivation was for developing a hybrid testing model approach that could combine the strengths of hypothesis testing, which include few assumptions, control for type 1 error, and the strengths of modeling, so better predictive performance. And this helps support better decisions and so benefits everybody in the clinical trial process, sponsors, researchers, statisticians, and patients.
The evaluation of this application done by the FDA was based on many things: the power to detect a significant dose-response relationship, type 1 error rate, as well as likelihood to find a minimal effective dose. The methods were evaluated under various model shapes and sizes, sample sizes, and the number of doses, and feedback was given, including the power to declare a positive dose-response relationship with the MCP-Mod method was compared to these tests, common tests used in statistical analysis, Dunnett's test, log likelihood ratio, Bayesian and non-parametric modeling approaches. All the methods were similar in performance. The finding of the FDA was that only the Dunnett's test was inferior in all aspects. The rest performed similarly in these regards. Some feedback provided included the fact that the MCP-Mod, it was shown to be sensitive to the initial model shapes chosen, and so reviewers are encouraging those who use this process to not limit that initial amount of shapes included in the procedure when making predictions. It was beneficial to include many different types of models as opposed to over limiting those initial candidate models. Additionally, reviewers provided feedback that power was decreased when the number of doses increased, but the sample size was kept constant. Also, the MCP mod performed similarly to the log likelihood ratio test, but it performed better when the assumption of monotonicity is violated. And then the MCP mod method was comparable or had comparable power and type 1 error to test for significant dose response relationship. So again, just reiterating the fact that the MCP mod performs similarly in many regards to these other tests, if not was found to be superior to them. In terms of finding the minimum effective dose, the MCP mod uses estimation methods to demonstrate the dose response curve for typical patients and to estimate percentiles for each of the dose effects. And so estimating the probability of the typical response to reach a threshold of a predefined clinical relevant effect. The benefit is that this estimated probability can be adjusted for uncertainty, like in our case, uncertainty in model selection. The MCP mod procedure relies on modeling methods to estimate the minimum effective dose. And in this review, the MCP mod performed comparably to tested modeling methods and to the hybrid methods in regards to the power to find the minimum effective dose. As stated, this isn't the only hybrid method to be introduced into literature, so here are a couple other resources for further study.